Erectile dysfunction is such a common disease process that so many men suffer from, and we've almost become ashamed to discuss it. They can be very mild to where it's just small changes.
Sexual dysfunction. Which is when the menopause hits and they have lower libido and that, which obviously there are treatments for that as well. So to clarify, erectile dysfunction is someone who is not able to have an erection, not able to hold it during intercourse. Hi everyone, how you doing today? Welcome to another episode of Venciendoladepre. My name is Adolfo Segovia, and today I have an amazing guest. We're gonna talk about a really important topic that affects millions of people in the world. So super excited about this episode. Before we begin, I wanna give a brief introduction of who I am. Again, my name is Adolfo Segovia. I'm the host and founder of Venciendoladepre. I founded this podcast because I was abducted by a drug cartel when I was 18 years old. After a couple of months after that, I was assaulted at gunpoint. And then my family and we were forced to escape Mexico and move to the US. All that happened in a period of 3 to 4 months. After that, we moved once we got to the US, we were here alone with no money, and a lot of other horrible things happened that led me to suffer from depression, and I suffered for depression for about 8 to 10 years. Thank God, today I'm feeling really good. I'm almost cured. I don't want to say I'm 100% cured because depression is an everyday battle, but I'm feeling really good. It took me years even to realize that I had depression, but now I'm doing good, and now I made my purpose, or one of my goals in life is to help others to get outside of depression, to overcome depression and all other conditions related to depression, anxiety, etc. So 2 really quick commercials before we start with our guest. I just want to talk really quick about MindBiotix. MindBiotix is a natural supplement. It's a supplement that you can take, and it can help you relieve the symptoms of depression. It works at the microbiome. You just take it 2 pills at night, and it helps recover your microbiome, and that affects the brain. Now there's a ton of studies that shows that the microbiome is directly connected to the brain. So if you work at the microbiome level, you can also affect your brain. And the second commercial is that I just opened an insurance agency in Florida. So if you're in Florida, I can help you with your car, home, and business insurance. The name is NextGuard Insurance, and the information is going to appear there. So now let's go back to our guest. Today we have Chrislyn Chaloupka. She's a nurse practitioner and an expert on erectile dysfunction. So today we're going to talk about erectile dysfunction because I know that it affects almost 50 million men just in the USA. And I don't know a lot about erectile dysfunction. I don't suffer from that, but as a man, I know that one of the worst things that can happen to a man is to not being able to perform with your partner, with your wife, or performing better, have sex. Okay, I guess we're adults on this podcast, so that's something that I'm sure it affects a lot of men. I mean, it really affects men. There are millions suffering from that. So the nurse practitioner Chrislyn is going to talk about everything about related to ED, plus a new treatment that can help you cure or almost cure ED. So she's going to talk about that. So please welcome Chrislyn Chaloupka. How are you doing today?
I'm great, Adolfo. Thank you for having me.
Thank you for being here.
All right. So you're
so Chrislyn,
yeah,
please go ahead.
No, so you're absolutely right. Erectile dysfunction is such a common disease process that so many men suffer from, and we've almost become ashamed to discuss it. It's something that men don't want to talk about. They suffer in silence a lot with it, which when we don't treat something and we don't address it, then that can lead to depression and anxiety. It can lead to difficulties in marriages. So it's really important that we begin to be comfortable talking about it and sharing with those that can help us find out other options for treatment, but also just recognize actually how prominent it really is. You're not alone.
Yeah. It's like depression.
It is.
We don't like to talk about depression. I suffered from depression for almost 10 years. The first 5, I didn't even know I had depression.
Mm-hmm.
And I had to go to 20 doctors to realize that I had depression. And then I didn't want to talk about that. I was ashamed. I was sad. I was not prepared until it took me years to be able to talk about depression. But Chrislyn, before we start, can you introduce yourself a little bit? Tell us about your career, your profession, what do you do,
Yes, so I'm a
your
nurse
credentials?
Yes, I'm a nurse practitioner in Houston, Texas. I specialize in really overall health and wellness, and I primarily focus amongst weight loss, nutrition, exercise, sexual wellness with men and women, so a lot of erectile dysfunction, and regenerative as well as longevity medicine. So my focus with my patients is really helping people live longer, but not just live longer, feel better, and live longer, have a better quality of life and really do treat our bodies the way that they were intended to be treated, healthy, natural, and be able to really kind of retake hold over ourselves and improve our overall quality of life. So I do a lot of
All
different
that.
things with my patients. It's a lot of hormones
Yeah,
as well.
you do a lot of different things.
Yeah,
Okay, Chrislyn, what is erectile dysfunction? For the people who don't know, which there might be some who don't
sure.
know,
Well, and
what is erectile
it's a
dysfunction?
great question because it's not as straightforward as one might think. I think typically we think of erectile dysfunction solely as I can't get an erection, but that's not the only thing that we can classify as erectile dysfunction. It actually can be as simple as those initial changes that we start to see with the erectile quality. So, one of the things that I have my patients fill out is a survey of sorts that explains their erectile quality for me because there's different levels of erectile dysfunction. They can be very mild to where it's just small changes. Maybe the strength of the erection is not as strong as it once was. It can be that it doesn't last as long as it used to. They could have trouble penetrating during intercourse. They could have
I'm
trouble.
laughing because I guess I have some of those symptoms.
And you're like, I
Maybe I
don't
do.
have this. I don't
I
have this.
know.
Wait, maybe I do.
Maybe I do.
So as we get older, it's very common for us to start seeing some of those small changes. And a lot of times men will ignore them as just very minor changes. I didn't drink enough water. I have drank too much alcohol. I'm not on my A game with, new medications. There's a lot of different reasons for it. And we'll go into that in a little bit later too. But it's a very broad description of changes in erectile quality. And of course, it is as well not being able to get an erection, not being able to hold an erection strong enough for penetration to be able to have sex with their partner. The other way I like to classify it is not just erectile dysfunction, but male performance. I think that really covers the whole concept a lot better because those early changes fall under a decrease in male performance. And those are those early signs that there's something more going on. And like we talked about, they can be unrecognizable at first, and you blow it off as it was a one-time thing. And then all of a sudden, that one-time thing begins to happen more frequently, and it leaves you questioning what's going on with me. And where I think this conversation fits so appropriately with your podcast is the role that that takes on a male and their confidence and
Yeah.
depression because not being able to get an erection, it almost devalues your sense of being a man and it affects your psyche. And then once you start that, it becomes a vicious cycle of fear of having sex because what if I can't get it up? You don't want to experience that failure. And that again begins to destroy your confidence level. So then it changes the dynamic of you and your partner, even as far as being intimate. And that can play a role in how a relationship succeeds or fails.
Yes, as I said, I have not experienced ED, but as a young man, I sometimes I had some of the things that you just mentioned. I didn't perform that well today, maybe because I was not hydrated or I had too much alcohol or I super tired and it feels bad. I mean,
Yeah.
just having that, I didn't perform that well. For a man is horrible. It's like, oh my God, it's horrible. So I cannot imagine what not being able to have an erection would feel for a long period of time. Before we go deeper into the specifics of ED,
Hmm.
of the symptoms, because I want to know, I would like to know what would be considered a normal erection or a normal performance so we can compare.
Okay.
So what is normal?
Normal is a male being able to be aroused and that stimulating blood flow and circulation all throughout the penis in order for the penis to become engorged and stiff in order to penetrate for intercourse. That's normal. Okay.
And is time related to that, or time is another topic?
I think time is another topic because there's a lot of factors that can go into that as far as visual stimulation, physical stimulation, psychological component goes into that as well as
But you
far as
mentioned
past trauma.
performance. You mentioned performance. So how do I measure my performance?
Where performance would be the ability to get an erection in
Okay.
order to penetrate and the ability to climax. Okay. So all of those, there are different variations of dysfunction, and that for someone that's younger that might be seeing small changes, they might be able to get an erection without a problem. They may be able to penetrate and begin having intercourse, but they might find that their erection begins to diminish during intercourse, and then they can't finish, they can't climax. And so that's a small sign early on. Okay, there might be more going on. Maybe there's not enough blood flow to the penis all the way to the head in order to keep that engorgement. And that's why there's things on the market such as rings and pumps that produce more blood flow and they trap it.
I have to say that actually happened to me last time. Well, not last time, but that happened to me recently, where after I already had sex like 2-3 times, so I blame that.
That's a little different.
It was like the third erection, and
Yeah.
during the intercourse, suddenly it just went down.
Yeah. Lack of blood flow. The blood flow decreases.
But I blame the other two prior. So
well, yeah, and if that was all in one evening or day, then sometimes it can
was
happen.
like
back to back.
It was like back to back. Yeah. Third time back to back, plus half a bottle of whiskey.
I'm glad you brought that up. That's another big part of the topic as well, as far as we get older, but this is not uncommon when you're younger as well. When men mix alcohol with trying to have intercourse, it's very common for that to play a role in erectile dysfunction as well. So is that because of erectile dysfunction, or is that because of performance in the alcohol, of course, is a depressant to the body in general. So we will often see as men get old that if they drink more, then they will struggle to have an erection later on in the evening. I had a patient, definitely, a gentleman I think he was in his 50s, and he would have a glass of whiskey every night at dinner. Well, he came, he said, hey, I've got some ED. Yes, treatments were a good option for him, but he had one big key that he gave me, and it was, but I can wake up during the night and I can have intercourse with my wife, but I can't have intercourse with her when we go to bed. And so my first question was, do you have a drink of alcohol at dinner? He goes, well, yeah, I have a glass of whiskey every night. It was before dinner, after dinner, whatever. So, right. So then that wears off, that metabolizes out of your system. So in the middle of the night when you can wake up, now you're able to get an erection because it's no longer depressing your system. It's worn off.
But then is this person considered someone who has erectile dysfunction, or someone who is normal? It's just that if you drink, you cannot have sex.
Yeah, so I think the older we get, that becomes more of the norm. I think it's never really normal, but it is a sign that the aging process has deteriorated the circulation, and adding in the alcohol then depresses the circulatory system to bring the blood flow to the penis. So it's kind of a gray area. I think he does have performance issues, but they are directly related to the alcohol specifically, which we know to be a known cause, and no matter what the age is, but we see it worsening as you get older. You're much more sensitive to alcohol being mixed in.
So to clarify, erectile dysfunction is someone who is not able to have an erection, not able to hold it during intercourse, or not and or not able to climax. Those are the three
Yeah.
main points that we
hmm
can
And
classify
they
ED.
see their diminished capacity from what they once had. Most men are going to know this is not how I was when I was in my 20s or 30s.
Well, but that's not expected, right? It's normal to have some type of decrease, or we should expect to be 50-year-old and perform at the same level.
Well, that's a great question. So, erectile dysfunction and the inability to get an erection is actually a very early indicator of cardiovascular disease. And a lot of times we go to the doctor and men are given a blue pill, right? Here, I'm sorry, you're having trouble getting an erection. Take this, it'll help. And it works for a while. Where in truth is they really need to be looked at holistically to make sure that there's not a greater problem going on with their cardiovascular system. So I'm not saying everybody out there that has erectile dysfunction has heart disease, but I am saying there is a very, very strong correlation between the two, and we ignore some of that. So to answer your question, it doesn't have to be part of the normal aging process. For somebody that is very healthy, they're not obese, they eat very clean, they don't smoke, they don't drink a lot of alcohol, they're in very good shape from many different ways. Just overall, their metabolic system is very healthy. That male may never experience erectile dysfunction. His blood is able to freely flow and circulate from the heart to his arms, his legs, and his penis very efficiently. As we get older, we know that the vessels within our body begins to build plaque up, and that makes it harder for blood to travel through the vessels. And so that's what we begin to accept as being a normal part of the aging process. So I don't like the word normal because there's a lot of different ways to
I
determine
thought
what
it, I
normal
thought
is.
I thought it was normal to start having, erectile problems when you are 60, 70,
There's
50
plenty of
something.
men that are really healthy that don't have erectile dysfunction.
So
They've
it's
taken
not
care.
normal.
It is a change in the body's process to efficiently deliver blood flow. That change we have become to accept is normal because we do live in a society here in the US where we're not as healthy as a lot of other countries are, as far as how we take care of ourselves with diet and exercise.
Yeah.
So we're accepting it as normal, but I don't really feel that that is necessarily just a normal part of the aging process. So it doesn't have to
Okay.
be.
Chrislyn, can you talk about the effects on marriage, depression, on women?
Yeah. So, intimacy is incredibly important in any kind of relationship, whether it's just a long-term commitment or a marriage. And I find that oftentimes, as both partners, and I'll just use a male and female partner together as an example, it actually goes both ways, where we've kind of accepted the fact that females will have menopausal symptoms that can diminish our libido, and sex can become painful because of dryness, and we just kind of accept that, right? But for men having erectile dysfunction, it is looked at more of, oh, let's give you something to fix it because it can have an effect on the male's psyche. And if he can't perform, how does he feel? But the truth of it is that both men and women can suffer from sexual dysfunction, and it plays a role in a marriage when the intimacy disappears because you connect on a deeper level with that.
So
That's why
women
it's
suffer from, well, not
sex
erectile, but sexual
sexual
dysfunction,
dysfunction.
which is when the
Absolutely.
menopause hits and they have lower libido and that, which
Yeah.
obviously there are treatments for that as well.
There are, absolutely. And a lot of times, female sexual dysfunction is more related to change in hormones. And men's, erectile dysfunction can be related to testosterone deficiency as well, but it is primarily a blood flow disorder. But the two can both have sexual dysfunction. I bring that up because if I'm treating a patient, I really need to be making sure that I understand what their dynamic is at home, because if I
Yeah.
fix one and I don't fix the other, then what good have I really done? If I can help a male get an erection, but his wife is suffering from so much vaginal dryness that it's painful to have intercourse. Well, have I really
Yeah.
helped him then?
No,
No,
you create a problem.
I did, because now he can get an erection and he can't have sex at home, right?
Yeah.
So you have to be mindful of the whole situation. And so I really like to talk to, couples together to find out where everyone is at. But you're 100% accurate in saying that erectile dysfunction plays a role in the quality of a marriage. Again, it goes back to, what do we accept as normal? We accept as normal that this
Do you
be.
have any type of statistics of divorces or something like that related?
I don't know them off the top of my head, but obviously they're very high as far as just you disconnect, right? Like if you no longer able to find a way to have intimacy, and intimacy is not always sex, right? It's about connection, but sometimes connecting on that level, it brings the intimacy to the marriage. And so, yeah, you have to be
So
aware of
now
it.
that we have all this, the blue pill and all these type of pills, are those for erectile dysfunction or are those for long to have sex for a longer time?
They're
What's the
intended,
primary
yeah,
use of
they're
those?
intended for erectile dysfunction to increase blood flow to the penis. And they do work for many people. It's putting a band-aid on the root cause, though. It's not going to cure anything. But for many people, they do work. They usually come with side effects such as a headache, stuffy nose, flushing. So some people don't like taking them. And then the other downfall is that you kind of lose some of the spontaneity of being intimate as well by having to take those. But, they're still beneficial to a male that has erectile dysfunction, and as far
So
as
though it's a
regaining their
treatment,
confidence.
that's a
It is a
treatment.
treatment.
That's a way to treat it.
Mm-hmm.
Okay,
Yes.
so Chrislyn, what are the main things that there are different type of things that can cause erectile dysfunction, not only the heart and the fluid flow, but we also talk about mental, and that happens a
Yeah.
lot too.
Yeah. So there's also other medications that we take, antidepressants. So as we talk about the psychological effect, we'll go into that next, but those that do suffer from depression or anxiety, certain medications that are prescribed to manage those conditions can have a side effect of erectile dysfunction as well. Sometimes it just reduces the ability to get an erection, and other times it reduces the ability to climax and have an orgasm. So it can have varying degrees of dysfunction, which then brings back to that feeling of low confidence and depression. So you're kind of in a vicious cycle. But I'm
Yeah.
not downplaying, antidepressants. I do believe that there's a time and a place where they're appropriate, and some people absolutely need them. So I don't want to discount them.
Something that happened to me personally when I was depressed is that when I was really in a depressive state is not ED, but low libido, low
Yeah.
sex drive. Like
Yeah.
you just don't think about sex.
Mm-hmm.
And another thing that has happened is the ability to not climax, but
Mm-hmm.
that's because I take anti-anxiety pills,
Yeah.
and sometimes that doesn't let me have a climax, which I don't see it as that bad because at least I feel like, oh, I'm too much, I don't even come.
Yeah.
But sometimes it feels bad.
Frustrating. Right. Sometimes
And
it's
it's
frustrating.
frustrating for women too.
Yeah.
I had partners who felt frustrated because I don't come, I
Right.
don't climax.
That goes
And
back to the intimacy.
they think that, oh, you don't like me, you don't feel attracted to me. And I'm, no, it's just the pill that sometimes, I don't know, gets crazy and I don't climax, but it's
I
not
think
still related to that.
I think that's very common, that a lot of men don't realize the importance of the male climaxing with them, not necessarily at the same time, but that does bring another level of, maybe that's our issue with as women, is it gives us our confidence of, okay, I was fulfilling enough for you to be
Yeah,
able to achieve that too. And I absolutely understand that. And I think it
no,
also is something that brings the couple together on an intimate level, because as a male, that's what you want. You want to please the female, right? You're over there,
yeah,
you want her to have an orgasm. Well, we want the
yeah,
same thing. We want you to too, you
yeah,
know? So
yeah,
it
it's
does go
true,
both ways.
true.
Yeah. Yeah.
That is true.
And
Okay,
this,
so Please go ahead.
No, I was just saying the psychological aspect of men that suffer from depression, not as a primary cause of their erectile dysfunction, but for other related situational issues. Maybe it's, stress at work, or there's already a relational or estrangement. Maybe there is just really an unresolved depression that has been around for decades that they struggle with, major depressive disorder, bipolar. There's different conditions that we experience with depression, and it's not always about the medication that we're on to treat those, but the ability to, redirect our thought process.
Yeah.
And it really does play a role in the ability to get an erection. Now, when we have a psychological component like that, such as pure depression, that alone is not obstructing blood flow to the penis to not allow an erection, right? That is related to the psyche itself and the inability to get in the right headspace and allow that
But
libido to come up.
if it's the psyche and if you stimulate the penis, can you get the blood flow?
So a lot of times you'll be able to stimulate the blood flow, but it can become a challenge to maintain it. And that's where
Okay.
devices like penis pumps and rings that actually trap the blood flow in the penis can be helpful, because you can get it started, but it's hard to keep it erect. And so using
Okay.
those things can help. But I would say the psychological component in dealing with depression, when you know that it's not a vicious cycle as far as, okay, I'm struggling with ED and that's making me depressed. And then therefore, and it is already dealing with depression on its own. And then that is affecting the erectile quality. That's a little bit of a different conversation. And it is
Yeah,
very
just
important
the
to
stress of life. The stress of
exactly.
life.
Yeah, and that's where, managing the depression, whether it's therapy, talk therapy, being able to confide in someone with what you're dealing with is incredibly important.
Okay, so before we talk about treatments, what are natural things that men can do if they are suffering? Are there any type of natural
Yeah,
things or
yeah.
things that men can do to work on this?
There's a lot of lifestyle changes. I feel like that's the most important thing that we can do to help erectile dysfunction, even when we're seeing these changes early on. And those things would be not smoking, right? Stopping if you are. That's huge because that affects the blood flow all throughout our body, in particular the penis, because you're going to start seeing it there first before you notice it anywhere else. So stopping smoking. Reducing or stopping alcohol intake. We've already talked about how alcohol can affect the erection. That's going to be huge. What are you eating? What are you putting in your body? Eating a diet high in processed foods, high in sugar, is very bad for the body overall. So eating a clean diet. When I teach nutrition to my patients, I'm real big on the Mediterranean diet in the sense of lean proteins, lots of vegetables, low carb, low sugar. I don't ever take anything out. It's about moderation, not deprivation, but it is about eating cleaner. So for this patient, something that they could be doing is they can go around the store and purchase their items on the perimeter. That means the produce, the meat, the dairy, and getting few items in between on the aisles that they need in order to make a meal. But that alone is going to take out so many of the preservatives and chemicals in your diet. It's going to take away a lot of the fat, the sodium. We want those leaner proteins, even if they're coming from natural sources, are okay. We need some fat, right? We need some carbs, we need some fat. That's healthy for us, but it's about eating the right foods and in the right amount of moderation. So those are all things that we can do. And then exercise. Exercise is incredibly important. Cardiovascular, doing cardio work, but also weight training is very important. That actually doing all of these things, clean eating, exercise, can actually increase your testosterone naturally, but it's also helping clear out those blood vessels and keeping the cholesterol down. To make sure that we're getting enough fiber in our diet as well is very important.
Okay.
Drinking plenty of water.
Chrislyn, what are the ages when it's kind of normal to start seeing ED, and when are the what and what age it would be abnormal?
We're definitely seeing changes, those early changes that we talked about initially, younger than we used to. So we are seeing men in their 30s start to come up with concerns. Those are those small changes that I started talking about. And then definitely by their 40s and into their 50s is usually when I will get male patients coming in with more prominent concerns of erectile dysfunction. So I would say if I had to pick an average decade of life, it's probably in their 50s. If you're experiencing these symptoms and you're in your teens, you really need a complete workup to see what all might be going on from a hormone perspective, from a cardiovascular perspective. There's a lot of different things that should be evaluated. So if you're in your 20s and you're experiencing erectile dysfunction, then you really need to reach out to your healthcare provider. When we get into into our 50s decade of life, then we should really start questioning, what am I doing at home that could be contributing to this? Just like I mentioned, all of those lifestyle changes. We get busy with work, we travel, we get to the 8 to 5. Some of us are working 12-hour days, maybe more than 5 days a week. And we stop taking care of ourselves. And so it's really important that we look at what we're doing from that perspective. And then what are we doing to recover emotionally from all the stress that we're under? I think that plays into the issue with depression and anxiety too. We're so used to go, 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 go. I'm guilty of that as well. And what am I doing to recharge? And sometimes even erectile dysfunction is related to the stress that we're under.
Yeah,
We're
it's
not,
just stress.
yeah, exactly. So there's so many different causes. I think we have to realize there's also a difference between causation and association. And, the cause is a root cause, like the lack of blood flow to the penis. An association would be doing or say something like stress that is affecting the erectile quality, but I can work on the stress and I can improve the erectile quality. So there's a difference between causation and association with this.
What about your 60s, 70s?
Yeah.
Is that I don't even know how
So
sex should look at that age.
to be honest with you, I have men in their 80s that are still having sex. They are completely active and they have no erectile dysfunction. And
But
those
I guess
men,
it's the few, or it should be normal. A healthy
it's
man should be able to have sex in
exactly,
their 80s.
yeah. These men are men that are still outside running. They're cycling. You would never guess their age other than their hair color and their wrinkles, right? They're active. And that's why I say it's so important for us to treat our bodies right in order for us to live a good quality of life. It's not about just living longer, it's about living better. And that's a
And enjoying
prime
life.
example. Exactly. I mean, don't we all wish that we're in our 80s and running and cycling and still having sex? I do.
I wish. I
Yeah,
hope so. So that's
exactly.
actually a really good metric, because if
Yes,
you are in your
it's possible.
60s, 70, and you are not having sex, it's not normal.
Right?
You should get treated. There are options for you.
There are.
So for the people who cannot take the blue pill and all these things which are not actually cures, are just remedies, what options do they have? Or people who just don't like to take those type of medications because they have side effects and things like that.
Right.
What's the new option? What's out there
So
for
one
them?
thing that I do in my clinic is we offer shockwave therapy, which I know the term sounds scary, but it's not. We offer a treatment called Gainswave, and it is using sound waves that actually stimulate blood flow on the penis to create a new network of blood vessels that will increase the blood flow to the penis. And it also breaks up kind of that micro plaque within the vessels to allow better blood flow to the penis as well. So that is actually treating the root cause of erectile dysfunction when the cause is related to plaque buildup within the vessels at cardiovascular disease workup, right? Which we see through the penis. And
Or it could be the heart. If it's
Mhm.
heart function, then it's another problem, right?
Well, the heart function is the underlying cause as far as why the penis can't get the blood flow. So that was why I brought that up, because some men, they don't realize, maybe they don't have high blood pressure, they're not aware of high cholesterol, they don't see a cardiologist, but they go to their primary care and they say, hey, I'm having trouble with erections, and they're just given a blue pill, right? But that could be a sign of more going on with their heart, and their heart needs to be evaluated. If the heart is not able to freely pump and flow blood throughout the body, the penis will be one of the first things that shows up with a problem with erectile dysfunction.
But if there's an option that maybe my penis is right. I don't have plaque. I don't have anything. It's my heart that is not pumping enough blood.
Yeah. Yeah. The
Okay, so
heart function.
first you need to evaluate the heart, I'm assuming.
That is how I approach it. I find that that is the most important because it's often the most overlooked problem. And it's missed because, say, for your average male, they're not experiencing chest pain. They're not experiencing high blood pressure yet. And so they don't go to a cardiologist to have a workup done. And have that baseline done with your cardiologist to say, hey, you're good. It's early signs of changes, right, with blood flow, but overall your heart is in good health. But don't ignore that sign and not go get a good checkup because there could be something more going on. You never know. You hear about people all the time that go in, they had no
Yeah.
idea they were getting ready to have a heart attack. They were in the
Yeah.
right place at the right time. They had maybe a heart cath, right? When they had stents placed, there's different things that can be done, but it's so often missed as a cause when we're talking about erectile dysfunction. The heart just doesn't get thought of first, and there's a huge correlation there.
Okay, so this new treatment, the sound waves. So these are sound. It's not vibration, it's just sound.
Yeah, they're created by sound waves. So shock wave is actually a sound wave that breaks the sound barrier. That is what a true shock wave is. So there are different devices on the market that produce this shock wave, but the treatment protocol that I use is Gains Wave, where I actually also, I'm the director of the clinical services for them as well. So I've helped develop these protocols for men for erectile dysfunction in order to improve blood flow to the penis. And I've had absolutely amazing results. I would say typically 80 to 85% of male patients have success or improvement. And we have to understand what kind of outcome we're looking for with our patient. Is it realistic to say that the 75-year-old who's struggled with erectile dysfunction is going to have an erection like he did when he was 20? Not necessarily, right? However, it's realistic to say that same 75-year-old who no longer responds to the blue pill after I do this treatment and I increase the blood flow to the penis, now when he goes and takes that blue pill, the blood is able to flow and rush to the penis, right? It's able to get through. So that's kind of the worst case scenario with those patients that have a lot going on. They may be diabetic, they may have high blood pressure, high cholesterol. So I'm still going to consider that a success because that patient is still able to have sex again. They're still able to be intimate with their partner. The average patient that's coming through that is seeing those small, I will say mild to moderate changes, they're usually going to be able to get an erection without having to take a blue pill or any kind of injectable options after doing anywhere between 6 to 12 treatments of the shockwave therapy.
Okay, 6 to 12 treatments of the shockwave therapy. And how long it takes?
Yeah, so it depends on what device the provider has. With one of the devices that we often promote, it takes about 10 to 15 minutes for the treatment. It's completely pain-free to the patient. So I know it sounds a little unsettling to know that you're taking something up and down the penis called a shockwave, but it actually is painless. And it takes about 10 to 15 minutes once a week, anywhere from 6 to 12 weeks, depending on the need of the patient, like I was talking about with the conditions that they might have, like diabetes, high blood pressure. Would take a lot of their medical history into account to help determine the right treatment protocol for that patient.
And that's it, 6 to
That's it.
12 weeks, and you are good.
Yeah.
You are like a 20-year-old again.
Well,
Almost.
For the most part, and you do have to still do the right thing after you've opened up that blood flow and you've allowed the blood to flow to the penis. You have to keep up with it, which means the diet, the exercise, the stopping smoking, reducing alcohol. I refer to my patients as an analogy that once you go have open heart surgery and you have all the blood vessels back open again, you don't go to Burger King 3 times a week, right? You do what your body needs you to do now to keep it in good shape. This is the same thing. You have to treat your body right in order for you to maintain that blood flow. And then there's maintenance protocols that we can do as well. Sometimes it's just once a month, once every 3 months in order to keep those vessels open and re-stimulating the blood
Okay,
flow.
for the men who are a little shy, how does the treatment looks? Do you have to get naked? Do they put something on you? What do they do?
So your genitalia does have to be exposed. I have to be able to access the penis as well as the scrotum. I don't treat the scrotum, but I do treat above it and under it, the perineal area in between the scrotum and the anus. So you are exposed and your provider will be touching
Okay,
your penis. But,
okay.
if you're going to a medical professional, then this is something that they're used to doing, that they're used to treating. And I have found that most of my patients, they're so eager to see improvement and
Yeah,
have
you
their
don't care.
sexual function back. They don't care. They're
Okay.
excited that there's a treatment that's available to them.
But it's like a sound wave. It's like they put like
Yeah.
a speaker on you
No,
or something
it
like
looks
that.
like it looks like a speaker, I guess. It's like a little hand piece
Yeah.
and it has a very loud
Okay.
clicking sound, right? It's gonna
Okay.
sound
Yeah.
like
No
that.
one is gonna be touching you or
No,
nothing
you
like
don't
that.
feel a shock or anything. The device does touch the penis as well as the base of the penis and then the perineum, but you
So
don't
it's pretty
feel.
much unclogging the penis,
That's the best way to say it. Yeah. In
unclogging
layman
the
terms.
arteries,
Yeah.
right?
Right. Right. We're opening up
Yes.
the blood flow. So it's treating the root cause, which is going
And
to
this
give you better
as the
results.
root cause. So basically, the cause is of ED in some cases is that the arteries get clogged by
Exactly.
plaque, and you unclog them
Yeah.
with shock waves.
And create new vessels.
Awesome,
Yeah.
awesome. I think that's amazing. In terms of for people who would like to do it, is it covered by insurance? Is it too expensive?
It's not covered by insurance. It is typically a cash pay treatment. And it's around, for 6 treatments, it's usually around $3,000. For a series of 12, it's about 5,000. So it's not incredibly
It's
expensive
affordable.
for, yeah, it's pretty average price, I think, when you're talking about that concierge level medicine that you're getting. And then, if you're looking for a provider near you to do that treatment, the best thing to do is go to gainswave.com, GAINSWAV as in Victor, E.com, and you can type in your zip code and it will pull up providers near you and you can find somebody that you're comfortable seeing that can offer that treatment for you.
That's amazing. Okay, really quick. For women suffering from low sex drive or, well, I guess vaginal dryness, is that
Yeah.
a major thing because there are lubricants, right? Or
Well,
that's something else.
so it's absolutely a thing because when you're talking about vaginal dryness and, oh, use a lubricant, well, that's in relation to having sex. But a lot of women suffer from vaginal dryness day to day, and many women will complain about it actually feeling like sandpaper in between their legs just when they walk. Well,
My God.
there are lubricants that they can insert. They're very messy. A lot of women get very annoyed with them. A lot of times it's hormonal related as well. Some women are open to being on bioidentical hormone therapy to help resolve some of that, and others are not. But this same treatment can be used to help them as well. And it again goes back to increasing the blood flow to the vaginal tissue and
So the
helping with
shock
health.
waves, you can use it for women as well.
You can, yes.
But that's just for vaginal dryness or for
Pain.
libido and
It's not going to
everything.
affect libido. Libido is directly affected by our hormones. However, what I teach my providers is if my patient doesn't want to have sex because they have painful sex or as a male, they struggle to get an erection, that therefore makes their libido go down, right? But if I can make sex fun again, and I can get you to have an erection as a male, or I can increase your vaginal lubrication and make sex less painful as a female, naturally that libido will come back up because now I can enjoy it again.
Okay, of course, makes sense. Are there any other reasons why women don't want to have sex?
Well, I think sometimes there's trauma, right? I think we
Yeah,
definitely
yeah,
know
yeah,
the
trauma.
psychological aspect of it. Trauma can be involved.
And stress
Use
too, and anxiety and
stress,
depression and
all of that. The mind is a huge part of us, not male or female, not wanting to have sex, whether it's just a libido issue or not, as well as hormones. And that goes for men and women as well. If our hormones are really low, our testosterone, our estrogen, those are going to play a role in our ability to have sex, but also our desire to have sex.
and I would say maybe the same, a healthy lifestyle.
Yes, absolutely.
I had an ex-partner who she was smoking a lot of cigarettes, and I noticed she had like lower sex drive than other women. So I guess that affects as well.
I mean, smoking is just has no good effect on our body in general, right? So, yeah,
Yeah,
absolutely.
and alcohol as well, right?
Alcohol,
For women,
huge.
does it affect women
Yes,
as well?
absolutely. It's a depressant. No matter who is drinking alcohol, alcohol is a depressant. Whether it is affecting our mind when we're already depressed, it can make us more depressed. And then it also can make us lose our desire for having sex as well.
I thought alcohol usually makes people want to have more sex.
I think it lowers your inhibitions, but I think it can make it more difficult to have sex. For a
What
lot of women,
about,
it makes it makes them tired. And so if I'm so tired, well, now that's just a lot of work.
or it makes them horny? Could that be? I mean,
I mean,
obviously
that's a good
I
question.
guess the
I
right
don't,
amount,
yeah,
right?
I mean, I
Not,
guess that's a fine balance, right? Like
yes.
we all know people go out and they have a couple drinks and they loosen up and okay, let's have fun. But there's a fine line of crossing that feeling good and playful and then being trash and I gotta lie down or being sick or
Yeah,
now you
man.
can't get
So
an
tired,
erection.
you don't want to have sex.
Yeah,
Okay. Well, I think that's amazing. Everything that you taught us today, it's amazing. I love
great.
it. Basically, you can help people, both men and women, to have sex again
Absolutely.
and
Isn't that a
be
cool job?
happy. Amazing. That's the best job.
It is.
So yeah, I mean, what else? What else would you like to say to people? What would your message to everyone out there? Recover yourself, right?
Absolutely. My message is don't accept your current place in life as where you have to be, whether that is sexually speaking, where you feel like you can't function anymore. There are alternatives out there to help you. Whether you suffer from depression and anxiety, there's help out there, whether it is a therapist, somebody just to talk to, maybe it's medication. I think there's so many different ways that we could be uplifting ourselves and each other, and it's time that we really focus on all of that.
Yes. Thank you so much. Thank you so much for everyone watching this episode. We definitely want everyone to enjoy their lives to
Yes.
the best of our abilities, and sex is something extremely important for couples, for singles, for everyone.
Yeah.
It's part of our design.
Hmm.
It's a need. I would call it a need.
Yeah, I would too.
So go have sex. Go have sex, enjoy, and if you cannot have sex with responsibility, with the right person, all
That's right.
that, but
That's right.
and if you cannot do it, if you are having these problems, please look for help. There are a lot of different treatments, therapies. Chrislyn has, we're gonna have her social media. Reach out to her. Go to bluewave.gainswave.com. Check it out. Don't like
Don't
what would
accept
you
your
say?
current state as where
Exactly.
you
Don't
have to
accept
be.
your current state. Don't be average. Be exceptional and perform. We all want to have amazing sex. So thank you so much. Let's go have sex.
All
And
right.
if you cannot have sex because you're single, then don't do it. Thank you so much for
Thank
watching
you.
this episode. Please contact Chrislyn, and thank you so much. We love you, and God bless you all. Thank you.